live. It's Tuesdays with Tina getting going. Today we're going to be talking about anesthesia and medical emergencies like syncope along with it. And for those of you that have been following along, you know I normally go live at 5:45, and today was a crazy day. So I'm late. So hello Instagram. I've got Instagram right here looking at you all up there. Hello. And then I've got Facebook down here. Hello Facebook group. So today, like I said, was a really crazy day. Talk about Tuesdays with Tina. Every single patient in my chair today, all the alerts on their chart saying only wants to be seen by me, right? We all have those patients where they only want to be seen by that one clinician. And today happened to be that day for me, and that also means that those patients need a little extra TLC. So everything just took longer, and I didn't get home until like literally 2 minutes ago, almost 45 minutes after I normally get home. So thank you for your patience as I get going and get on live, and as I come on live later than I had planned on to. So today what I want to do is just spend a couple of moments just talking about anesthesia and the emergency situation that happens most likely with that, right? Because I always like to talk about local anesthesia, and I wanted to start sharing some information about medical emergencies with you as well. And as we know, or maybe you don't know, the most common time for our patients to have a medical emergency in the office is right after we administer local anesthesia. And the most common emergency situation that's going to happen is going to be syncope. Like they're going to have a syncopal event during that situation, during that time. And I think it's really important for us to understand that and be aware of it. The thing is that when our patients are having an injection done, it's a scary situation for them, right? They're white knuckling it throughout the entire time. They're, are really nervous. They're in pain, whether because, they're coming in there because of pain, or they're maybe in some psychological pain because they're having to be at the dental office, right? A lot of times patients who are highly fearful will have that. And then there's the concern about the pain of the injection that might be happening with that as well. Hello, friends up on Instagram. Thank you for saying hi. So those are things to be aware of. And when that happens, that puts our patient at a higher opportunity to have a fainting spell, a syncopal event after our anesthetic delivery. So let's talk a little bit about what does that look like if a patient is getting ready to have that syncopal event, that fainting spell. Syncope is our medical term for that, correct? So one of the things that we want to be aware of is we want to start, looking at them. If the coloring goes out of their face, these are things that we need to be aware of. And I know it can sometimes be kind of hard to identify that, but you will start to see more of a whitish, maybe greenish tint to their skin tone. You will start to see maybe sometimes even just a light sweat starting to happen. The patient might even tell you, oh, I don't feel very good. I'm starting to feel faint, right? So you want to be aware, talking with your patient, when you're done, don't sit them all the way back up. Let them sit in a kind of partially reclined situation. So that way, if they do start to have that passing out, they're not having in a situation where they're going to be falling with their head forward, right? We don't want them to do this because that cuts off the airway. We don't want that to happen. So keeping our patients in a back area. And we want to make sure that the room stays well ventilated. Keep that air flowing, because if it's really hot and stuffy in the room, if you happen to be in an office that has very tight, hot, stuffy quarters, that can also increase the opportunity for our patient to go through and have that kind of event. So keep the air circulating. So your patient will start to lose some of that coloration. They might break out in a light little bit of a sweat. They might tell you that they're feeling a little faint. And if they do tend to go out, you want to make sure you lay them back. Make sure their airway stays open, okay? But before that, if that starts to happen, some things that you can do to help them out is getting a nice cool cloth. Something that they can put on their forehead or behind their neck. Sometimes even both is very helpful to be able to help manage that situation for them. Some other things that you might want to do again is get some really good air circulation going on. You may even have to break out your emergency oxygen and let them have some oxygen prior, while they're still conscious. Now, if they do go unconscious, you definitely want to have that oxygen tank, right? Get that emergency oxygen, roll it right on out so that way you know right where it's at, so you have it right there, because they're going to need that. You're going to need to make sure that their airway stays open. You may have to thrust their jaw forward and let them have that ventilation going through and helping them get that profuse oxygenation, okay? Now, sometimes people ask me, now Tina, if my patient passes out and has a syncopal event, can I continue with treatment? And, I've heard two different schools of thought on this. One says, nope, they're done, discontinue treatment, send them home, make sure somebody drives them home. And then I've also heard, if the patient feels fine, then go ahead and do it. So I really think you have to have a conversation with your patients. Once they have that syncopal event, they're more likely to have another one later on. So it's very important that they do have someone drive them home. And I think we also have to think about, like, how long were they out for, and how long will they be sitting with you? In order to be able to have another opportunity for them to have that syncopal event. So really, I've heard two different things. I grew up with the thought process and the knowledge of, once that happens, you're done with treatment and send them home. That's a very, very conservative approach. And my thought processes are starting to change a little bit with that. On really having a dialogue with the patient and seeing where they're at, and going, okay, what is the treatment that we're doing, and how can we go ahead and mitigate some of the extra risk factors with that. So just wanted to share that information with you. If that is helpful for you at all, please let me know. If you're watching this back on the recording, because again, I'm coming on a whole 15 minutes later than I normally do. So some of the normal people that might be logging in may have missed some of this. So if you have questions, please send me a message and let me know. Send me some comments if you have any of your personal experiences with a patient passing out. I had one time, I was at the school actually, and the patient had just been anesthetized, and they were like, oh, before we get started, so now that you got me numb, I want to go ahead and go use the bathroom. And right after their injection, they sat up, and it was like they sat up, and then it was like, they sat back down real quick. They didn't go out at all, but there was a lot of commotion surrounding that. And it was like, we had to remind our patients too, okay, I need you to sit here and stay for a little bit. Like, let's let that anesthetic take a little effect before you go to the bathroom, or say, hey, before we get started, why don't you go use the bathroom before we get started? Okay. If I would give it a good 5 minutes, let that anesthetic take effect, good 5 minutes. If they need to use the bathroom, just say, okay, let's sit here for a few minutes before you go use the bathroom. Another experience that we had was, in a radiology area, had a patient going through and getting x-rays, and had a patient go ahead and pass out while they were getting x-rays, like full on, fell forward out of the chair. We had to grab them out of the chair and guide them onto the floor, open up their airway, get them some oxygen, and just prop their head, and then she was fine. But we sent her home because she was out. That was a very interesting event to have happen too. All right, so somebody just asked a question. What does charting look like following a syncope event? That's a really great question, and I would say I would work with your offices coming up with a protocol on what your charting would look like. And I'm thank you for that question, Lucy. I really appreciate it, because that's a great question. So first things you want to do when you're charting, that's one of the reasons why we take our pre-vitals. And when our patient comes in, you want to go ahead and take your blood pressure, pulse, check their respirations. We want to have that baseline information so that when an emergency situation happens, we have something to compare to, because we're going to want to take those vital signs. So you want to make sure that you have the vital signs, the pre-vital signs, and then when the emergency situation happens, you want to have those vital signs recorded as well. You also want to say, if they did have a syncopal event, note was the first thing? What was probably the precipitating factor that led up to it? Like, did it happen right after anesthesia, or were they did they try to stand up too fast? Like, did they have some sort of postural hypotension that led into a passing out type of unconsciousness type of a situation? Even though it's not syncope, it still is going into that unconsciousness type of a situation. So what was the precipitating factor for that? The other thing is we want to talk about what treatment did we do? What did we do to take care of that emergency situation? Okay. Did we deliver oxygen? If so, how long did we deliver oxygen? What was the pressure level? Was it with the nasal cannula? Was it with the face mask? Okay. Did we need to do that? Did we need to administer any other items? Did we have to use ammonia salts to wake them up? Did we have to do the sternal chest rub to wake them up? Sometimes, you can even like pull the little small hairs to wake them up. Did we need to do those things? What treatment did we do? And then we also want to talk about how well did the patient recover? Do we know about how long they were passed out for? Do we know when they came to? Like, how were they doing? Were they pretty coherent? What was happening? And those types of information. Did we call someone to give them a ride home? And who gave them a ride home? Okay. The other things I would say is if you have a patient that has a syncopal event, sometimes they can have what's called a carpal pedal spasm, where their hands and their feet will spasm. It almost can sometimes look like a seizure. Document that. Did the spasm start to happen? Okay. Those are type of things. So Lucy, I hope that answers your question. Great question. And I'll do another post sometime about, what are the important things that we need to chart in the event of a medical emergency in our offices, because that is part of our medical emergency team. Okay, right? We have to have someone on that team that is responsible for doing all of that chart notations for us. So I really appreciate that question. Okay, friends. Again, so sorry I came in late. Share this information with your buddies. If you heard about me from one of your buddies, great. If you are joining me for the first time, I'm so happy to have you here again. My name is Tina Clark. I'm a hygienist. I'm a lover of education, and I love sharing information with you, especially about anesthesia. And now we're diving into the world of head and neck anatomy and medical emergencies and stuff like that. So welcome. Thank you for being here. I'm here every Tuesday. Try to be here at 5:45. So sorry that this week I was late. So friends, have a great week. And as always, I always like to end my sessions with my Sunday Sunshine quote, which was, do something today that your future self will thank you for. And one of my friends said, you know what? Today I did yoga, and it's great. It can be, I had my 64 ounces of water, or it could be something as big as I went ahead and I took the plunge and made a larger investment into my 401k. So that's there for you. Oh, somebody just said, by the way, you gave your first AMSA injection today. Yes, congratulations. I'm so happy for you. I love the AMSA injection. I love it. It's one of my favorites. So congratulations. Yes, and it is an amazing injection. So good for you. You probably got to see all the beautiful blanching, and I bet did you get to have the numb from the premolars to the incisors? Oh, yay, congratulations. It makes me so happy. Thank you for sharing that with me, Rose. Really appreciate it. Okay, friends, and that was something you did today that your future self will thank you for, because you advanced your skill set and your anesthesia skills. So good job. So proud of you. All right, I will see you guys next week. All right, cheers. Bye.